Hello, Mishram.
Dr. Vinay, good evening.
Good evening, sir.
Good evening.
How are you, sir?
Yeah, good.
Yes, sir.
So, Acha, you have not communicated with the panelists about the questions and all?
No, sir, I didn't have their connections there. The
Acha, you
members
should
are
have
not there.
asked Nirmal or Bansi, no? Or you should have asked me.
Yeah, so because it's all, I got the details yesterday only, sir. So,
Okay, I think for some, Nirmal has sent you some questions.
I've spoken to Shafali and I have connected with the Koeli also now. And then only Dr. Alka, I didn't have her contact.
Acha, so you had
The
communication with
other two.
Alka and Koeli?
Yeah, Koeli, I had a chat just now, and then Shafali is joining late, so she.
Yeah, Shefali is joining at 7 o'clock.
Yeah, so yeah, just ask them to come a little early so that we can discuss.
Yeah, Koeli, good evening.
Good evening. Hello.
Yeah, good evening.
Hi, everybody.
Hi,
Dr.
sir.
Mishram, Koeli, KP, all good. All the best today. So it's a good morning from New York.
Okay. So you are very fresh, sir, then. We are on the fag end of the day.
Yeah, I just jet lag made me wake up at 4 o'clock, so that's fine. I'm sorry, a bit confusion because day, night, and I could not connect with all of you. But I think KP has spoken to few of them, and few questions I got from Trupti as well as Sonal. So that should be fine. Is Rajesh joining or He's
No,
busy.
he had some other things. That's what he told me.
Okay,
Okay.
no problem.
Hello, sir. Good evening.
Yeah, Sonal, good evening.
Hi, sir.
Yeah, good evening.
Hi, Sonal, how are you?
Yeah, Mansi, I think she has made the program live on
Hi,
YouTube.
sir.
No, now it's
I'm
live?
good. Thank you.
Yes,
Yes,
sir.
it's live.
It's live.
Can you stop it? Because people are just
Sonal,
joining, no?
you are in Pune, no? Sonal?
Yes, he is from Bharati Vidyapeeth.
Acha, Bharati Vidyapeeth, Pune.
Hello.
So you will introduce all the panelists, sir?
Yeah, I will introduce.
Okay, thank you. Okay, so 2.
Good evening, sir.
Good evening.
Alka, you can write about your introduction in the chat box if Mesham doesn't have the slides as he introduced last year.
I've actually sent the slide.
Okay, perfect. Thank you.
Thank you.
Acha, but this time we will not be projecting the slide. Is there any change? We'll just go for with the brief introduction.
That's fine. Let's not waste time on introductions. I agree completely.
Bhavesh, can you take Brajesh into the panel, please? He's in attendee.
Sir, is joined. Okay, okay.
Yeah, done, sir.
Thank you. Welcome, Brajesh.
Hi.
Hi, sir. Hi, sir.
Hi, Vinay. Just one thing, I have to leave a little early because I've got dinner plans.
I thought you will not join, sir, because You had evenings Saturday.
No, it's okay. I may have to go a little early, about 7:15 or so.
Yeah, okay, fine. Brajesh, good evening.
Good evening, Chandra. How's the movie scene going on? I get
good.
all your messages, but I can't attend any.
Yeah. We had a wonderful film festival last week of March, third week of March, 12 to 13. And, it went houseful. People were sitting on the ladder.
My God, fantastic. It's a good thing to have some sort of hobby besides neurology.
Yeah.
Yes, I think we do it and then we just fine tune.
Hi, Koeli, how are you?
All well. Good to see you.
Good to see you too.
Kohli is from Nagpur, you know.
Oh, is that right?
Yeah.
Yes, med school in Nagpur.
Oh, okay. There's government at there's only one, right? Oh, no.
One more minute to go.
Yeah.
So, Brajesh, you can request Kohli to be actively participate with your pediatric subsection. Both Vanyan and Brajesh can get her also part of Indian Academy of Neurology.
Great idea. Koeli, you need to
Associate.
just join.
Yeah. Trupti, welcome.
Good evening, sir. Good evening, everybody.
Good evening.
Good evening.
CM, would you like to wait
1
for
minute
2
and we'll
minutes?
start.
Yeah, you can start. Yeah.
Dear friends, good evening. On behalf of Indian Academy of Neurology and Pediatric Neurology subsection of IIN, I welcome you all for this Autism Awareness Program. Please accept our best wishes on occasion of World Autism Awareness Day. To inaugurate today's session, we have President of Indian Academy of Neurology, Dr. Nirmal Surya. Good morning, Dr. Nirmal Surya, because Nirmal Surya is joining from United States of America, and he's gone there to receive the award in the conference of American Academy of Neurology. So congratulations, Dr. Surya. Dr. Surya is the president of Indian Academy of Neurology.
Congratulations.
He's the chairman of Epilepsy Foundation, consultant neurologist at Bombay Hospital, Mumbai, and he was organizing chairman of World Federation of Neurorehabilitation and president-elect Asian region of World Federation of Neurology, World Federation of Neurorehabilitation. Welcome to you, sir.
Thank you, Chandrasekhar.
We have Professor Shefali Gulati, who will join soon at 7 p.m. and as one of the panelists. Shefali is professor of DM Pediatric Neurology program and faculty in charge, Center of Excellence and Advanced Research for Childhood Neurodevelopmental Disorders, and she is Chief Child Neurology Division, Department of Pediatrics, All India Institute of Medical Sciences, New Delhi. And she is President-elect, Association of Child Neurology, India 2023 to 25. We also have other panelist, Dr. Alka Subramaniam. She is a professor at BYL Nair Hospital, Mumbai. She's a child psychiatrist, and she pioneered the establishment of Learning Disability Clinic, Autism Center, and Remedial Center at Nair Hospital. She is co-chair of the SARC Child Psychiatry Foundation, and she also pioneered the establishment of Psychogeriatric Clinic at Nair Hospitals. Welcome, Dr. Alka Subramaniam.
Thank you.
We have Dr. Koili Sengupta, is a developmental pediatrician, and she did MA in clinical psychology from USA after doing her MBBS and DCH. And she has around 17 years of experience with children with developmental disabilities, mental health issues, as a consultant at Ummid Child Development Center and Children's Hospital in Mumbai. And she leads the World Health Organization's Caregiver Skill Training or CST program in India. Welcome, Dr. Koili. We have Dr. Sonal Chitnis, speech language psychologist at Bharati Vidyapit, Pune. And we also have Trupti Nikharje, occupational therapist at Nair Hospital, Mumbai. And she has done MSc in occupational therapy from GS Medical College. And she's working as occupational therapist at Nair Hospital, Mumbai since 2000. So all these panelists have a great experience, and they are attached to problem with children, developmental children, autism, and you will have a very wonderful interaction with them. I would also like to welcome Dr. Rajesh Udani, who is a pediatric neurologist at PD Hinduja National Hospital, and he is the chairman of Pediatric Neurology subsection of Indian Academy of Neurology. He has a lot of research work and a lot of publications. I would also like to welcome Dr. KP Vinayan, who is the moderator for today's session. He is head of the Department of Pediatric Neurology, Amrita Institute of Medical Sciences, Cochin, and he is a convener of Pediatric Neurology subsection of Indian Academy of Neurology. Welcome, Dr. Vinayan and Dr. Rajesh Udani. And all these panelists, you can interact with. Dr. Vinayan and Dr. Udani will ask them some questions, and then we will have, you would know about autism, you would have seen in the movies like Tare Jami Par, My Name is Khan, Rain Man, that we had screened some time back, which features Dustin Hoffman and Tom Cruise, and many great people had autism spectrum disorder. So I now request Dr. Nirmal Surya to inaugurate today's public education program on autism. Dr. Nirmal Surya.
धन्यवाद चंद्रशेखर मेश्राम. यहाँ पर उपस्थित एक्सपर्ट पैनलिस्ट जो कि पीडियाट्रिक सबसेक्शन और सबसेक्शन के अलावा भी और रिहेबिलिटेशन से संबंधित सारे लोगों का मैं वेलकम करता हूँ. आज वर्ल्ड ऑटिज्म डे है और मैंने पिछले 2 दिन जब न्यूयॉर्क में हूँ तो ये यहाँ पर इतनी ज्यादा अवेयरनेस इस बीमारी के बारे में है कि मैं आपको बता नहीं सकता. यहाँ पर हर स्कूल बस, हर जगह पर, मेन रोड्स पर वर्ल्ड ऑटिज्म डे के लिए बैनर लगे हुए हैं और उनके बारे में टीवी पे लगातार ऐड हैं. 2000 में जब हमने नायर हॉस्पिटल में भारत का पहला न्यूरो रिहेबिलिटेशन ओपीडी चालू किया था, तब हम लोगों को, पब्लिक को, ऑटिज्म और डिसलेक्सिया के बारे में कुछ ज्यादा मालूम नहीं था. पहला जब मल्टीडिसिप्लिनरी क्लिनिक जिसके अंदर ऑक्यूपेशन थेरापिस्ट, फिजियोथेरापिस्ट, क्लिनिकल साइकोलॉजिस्ट, स्पीच थेरापिस्ट और न्यूरोलॉजिस्ट जब ये सब साथ बैठकर मरीजों को देखने लगे, तो कई सारे मरीजों में जैसे सर्ब पॉल्सी है या लर्निंग डिसेबिलिटी है, इनके बारे में और ज्यादा बच्चों को जानकारी आने लगी। और तारे जमी पर के पिक्चर के बाद में इस बीमारी के बारे में बहुत ज्यादा अवेयरनेस हो गई। आप सब लोगों को मालूम है ऑटिज्म बहुत कॉमन बीमारी है और इसके कई सारे स्पेक्ट्रम डिसऑर्डर हैं जिसके बारे में हमारे बीच में एक्सपर्ट्स बात करेंगे, आपको बताएंगे। लेकिन इस बीमारी के लिए जो दवाई के अलावा जो इलाज है, दवाइयों का मेरे को नहीं मालूम है क्या है, लेकिन कितना फायदा है, लेकिन जो रिहेबिलिटेशन है स्पीच थेरापिस्ट, ऑक्यूपेशन थेरापिस्ट और साइकोलॉजिस्ट का, उससे डेफिनेटली एक बच्चे की लाइफ में चेंज लाया जा सकता है, जो हमने दिखाया। और 2000 से जो हमने एक न्यूरो रिहैब चालू की, उसके बाद में नायर ने लर्निंग डिसऑर्डर का क्लिनिक अलका देश पांडे के अंडर में चालू किया और उसमें भी गायत्री और हमारी तृप्ति भी वहां पर ज्वाइन किया। तो इस तरीके से पूरे देश में इस बीमारी के बारे में बहुत ज्यादा मालूमात लोगों को आने लगी और अब पेरेंट्स जो हैं वो काफी केयरफुल है कि ये ऑटिज्म है, मेरे बच्चे को ऑटिज्म स्पेक्ट्रम डिसऑर्डर हो सकता है। और पीडियाट्रिक न्यूरोलॉजी भी जो ग्रो हुई है, पीडियाट्रिशियन जो ग्रो हुए हैं, तो एक अर्ली इंटरवेंशन की जो बात होती है कि जल्दी से जल्दी मालूम पड़े 1 साल के अंदर, 2 साल के अंदर, और उसका ट्रीटमेंट कर कर उन बच्चों को कैसे नियर नॉर्मल लाया जाए। तो इस सारे बारे में आपसे आज बात करेंगे। और आप लोगों के जो भी सवाल है, whatever question you have, please write in the chat. I'm sure Vinan will take it and will try and satisfy all of you and see what best we can do through this awareness to your children suffering with the autism. With that note, I thank you, Chandrasekhar Meshram. Indian Academy of Neurology has taken a lead to create awareness, and our next will be on 11th of April on Parkinson's. You please kindly keep on joining our channel of YouTube, Twitter, or the Facebook, and you will get the best out of the experts from the neurology. With that note, I welcome all the expert channel. Thank you very much.
Thank you, Dr. Nirmal Surya. I would also like to welcome Mrs. Priyadarshini Raut, who has joined from Telangana. She is a mother of a patient with autism, and she will also share her experiences during the session. So I once again welcome you all, and we have to go ahead with the session. So I will request Dr. Vinayan to go ahead with the panel discussion. Thank you.
Thank you, sir. Before we'll go into that, the official moderating the session and the panel discussion, I would like to request Dr. Rajesh Udani, sir, to say a few words as he's the chair of the pediatric neurology subsection.
Thank you, Dr. Vidayan. हम सब पैंडेमिक से बाहर आ रहे हैं और ये तो आपको पता है कोविड का भयानक पैंडेमिक 2 साल से चल रहा है, लेकिन उसके इफेक्ट जो है सिर्फ बॉडी पे इफेक्ट नहीं हुआ है, मेंटल हेल्थ पे बहुत सारा इफेक्ट हुआ है। और हम देख रहे हैं, आपको भी शायद ये मालूम होगा कि ऑटिज्म का जो नंबर्स है बहुत ही बढ़ गए हैं। अब ये क्यों हुआ है वो हमारे पैनल डिस्कशन में डिस्कस करेंगे, लेकिन हम बहुत सारे देखते हैं अभी सिंस द टाइम लॉकडाउन हुआ है और जो स्क्रीन टाइम बढ़ा है और जो भी प्रॉब्लम्स हुए हैं। सो आई थिंक दिस इज अ रियल टॉपिकल डिस्कशन, वी नीड टू टॉक अबाउट इट लिटिल मोर, बिकॉज ये अर्ली रिकग्निशन जो है, जो करना चाहिए, वो मोस्ट इम्पोर्टेंट चीज है। और आई थिंक पेरेंट्स को पहले मालूम होना चाहिए, रिकग्नाइज करना चाहिए सिम्टम्स, उसके बाद में डॉक्टर को अप्रोच कर सकते हैं। I think we should start now. Thank you very much.
Okay, thank you, sir. With that note, so today is the World Autism Awareness Day. As you are aware that this day was actually announced by the United Nations General Assembly in 2008. So this is not like many other days, because Dr. Nirmal Surya, our president, is telling about that. This is a very important day for the United Nations and the World Health organization with all lot of activities in different parts of the world. And the theme for this year is inclusive quality education for all. That means you have to have a proper education for all these children, and that should be inclusive rather than putting them separately into different categories. So with that, we will start with this session that, as you all know, the prevalence of autism is a conservative estimate is now 1 in 100, but many studies have shown that it is much bigger, and there are a lot of discussions on that. So I would request Dr. Alka Subramaniam to start the discussions. Can you elaborate on what is autism and what is this autistic spectrum disorder, autistic disorder? And there is a lot of confusion regarding learning disability and mental retardation. So can you throw some light onto this? What we actually mean by autistic disorder?
Thank you, Dr. Viren. And at the outset, I'd like to thank the entire team of IN for having us here today on World Autism Day to discuss such an important topic and probably explore some myths and misconceptions about autism. So autism is actually a neurodevelopmental disorder. So it starts right in utero and it goes on throughout life. The basis of it is possibly a multifactorial genesis, but has a strong genetic basis too. And though we can intervene and change the trajectory, it doesn't go away. That's something which we have to tell parents right at the outset, that it is going to stay. What is our job is trying to intervene early to see that the child has a trajectory which is going to make them relatively independent and functional so that they can manage at their level best, right? So a few years ago, maybe about say 10, 15 years ago, we used to typify autism because as we started observing, there were a lot of psychiatrists right from like more than maybe 50, 100 years ago who had started observing these children, and they were earlier thought to have early onset psychosis. But then we found that they are actually a neurodevelopmental trajectory which is different from schizophrenia. And the terms autism, childhood disintegrative disorder, Rett's disorder in children, these things started coming up, and we actually tried to classify them. From the huge change from the classificatory systems of DSM-4 to DSM-5 was to bring them under one umbrella. There were two reasons for this change. One is that we are splitting hairs when we are trying to find symptomatology. And second, there were a lot of children who were not getting help. You see, in the Western world particularly, all the interventions are done at the community level, which is at the school. So they weren't getting this help because you didn't fit into that particular diagnostic nomenclature. So we kind of branched all of them into autism spectrum disorder. And that's also one of the reasons why we are seeing that we have this increase as far as the prevalence is concerned, because we have more and more who fall into that spectrum. But at least it's benefiting a lot of children in terms of the advantages, the concessions at the school level, the disability benefits that they can get once they come under that umbrella, which otherwise parents are not able to avail of. Now, there is a distinction and there's a lot of overlap between various conditions like attention deficit hyperactivity disorder, autism spectrum disorder, specific learning disability, and we don't use the word mental retardation anymore, we call it intellectual disability. So there's a lot of overlap because these are all neurodevelopmental disorders. The brain and the body does not say, I belong to this category and therefore I'm going to behave like this. That's for us. That's for us to understand, to try and help from a medical parlance, right? So people who have predominantly one type, the children, is what we then classify them as that. So children who have dyslexia, dysgraphia, dyscalculia, the ones who have problems with reading, writing, mathematics, curriculum based, which is what you saw in Tare Zameen Par. Children who tend to stay in their own world, do things repetitively, have problems with communication, both interpersonal and social communication, are the ones who have autism, like what you saw in My Name is Khan or in Rain Man. Children who have ADHD or attention deficit hyperactivity disorder are the ones who find it difficult to sustain attention. They're very highly impulsive, and if they usually very hyperactive when they are much younger, which sort of peters down as they grow older. Again, children who have intellectual disability are the ones who actually have a cognitive capacity which is much lower. So they are able to do things only up to a particular cognitive capacity, like we see in children with Down syndrome. It does not mean that they are actually incapable of doing things. Although if you have severe or profound disability, they are dependent on others, but we have to find their strengths and work upon their strengths while understanding their weaknesses. So actually the term disability is something that I really don't promote, because I truly believe all these children have a differential ability, and that's what we are here to help.
Yeah, thanks, Dr. Alka, for explaining it. And to put it in a nutshell, what we can say is that these children are differently abled, and they can have a different spectrum. And as Dr. Alka was mentioning, they can have different varieties of brain dysfunction. And that can be, sometimes we can call it as predominantly autistic and predominantly intellectual disability and predominant dyslexia. But there can be a lot of overlap. A single child can have all these things with different levels of things. So with that, I'll go to Dr. Koeli. As a developmental pediatrician, when somebody comes to you with a developmental issue, a parent is coming to you with a developmental issues, how can we consider that these things are, some of the symptoms are significant, some of the symptoms are not significant, especially there are a lot of literature regarding this kind of problems in the literature, and people are aware of these things. So how will you go about that at this point?
Yeah, Koeli, you can speak in mixed language, maybe Hindi, English.
Sure,
Yeah.
बिल्कुल. तो सबसे पहले मैं आप सभी का शुक्रिया अदा करूंगी कि आप लोगों ने हमें सबको बुलाया, और आज वर्ल्ड ऑटिज्म अवेयरनेस डे है. जैसे डॉक्टर सूर्या ने बोला, इस दिन को बहुत जगह पे वी कॉल इट लाइट इट अप ब्लू, सो द LIUB डे. एंड आई थिंक ये दिन का सिग्निफिकेंस ये है कि ये शुरुआत हुई थी अवेयरनेस बढ़ाने को लेके, और अभी the focus has now, very helpfully and very prominently shifted, not just from awareness to acceptance. So that's, I think, something that I would like to highlight. Now, going back to Dr. Vinayan's question, that how do we even figure out कि autism है या नहीं है? और ये बहुत जरूरी है, क्योंकि जब मेरे पास पालक आते हैं, माता पिता आते हैं, तो बहुत बार उनकी ये चिंता रहती है कि बच्चा अभी तक बात नहीं कर रहा है या बच्चा बोल नहीं रहा है. तो ये शुरुआत के 1 साल, 1.5 साल, 2 साल में ये चिंता लेके माता पिता आते हैं. तो तब हमारी डेवलपमेंटल स्पेशलिस्ट होने के नाते हमारी ये कोशिश रहती है ये समझने की, ये जो बात नहीं करना है, क्या ये एक आइसोलेटेड बात नहीं करने की या कम्युनिकेशन डिले है, या ये एक ब्रॉडर डेवलपमेंटल कॉन्टेक्स्ट का भाग है जिसमें बाकी भी दिक्कतें जुड़ी हुई हैं. तो और कौन सी दिक्कतें हैं जिनके ऊपर हम ध्यान देते हैं? So when a parent is coming with speech delay, my focus is on getting a detailed developmental profile of the child. I want to know, how does this child communicate? Which means I'm not just concerned about ये बच्चा कैसे बोलता है या कितना बोलता है, पर सबसे जरूरी है कि वो दूसरों की कही गई बात कैसे समझता है. How does the child understand instructions that are given by others, or what is this child's receptive communication level? और एक जो बहुत जरूरी चीज है, what is this child's ability to engage with those around him? दूसरों के साथ ये कैसे मेल जोल करता है. और मेल जोल तो बहुत बाद में आता है. सबसे पहली जो चीज आती है वो है लोगों की तरफ वो ध्यान किस तरीके से देता है, और किस प्रकार से वो लोगों के साथ अपनी इंटरेस्ट की चीजें शेयर करता है. Does he point? Does he show? Does she look at things that parents are pointing out? So what's the child's level of response to what parents are trying to show, and how in turn does the child want to share his or her interest. The third thing that we look at is बच्चे की overall behaviors और उसके interests कैसे हैं. क्या वो प्ले के स्टेजेस होते हैं, 2 साल में बच्चे लोग एक दूसरे के साथ नहीं खेलते हैं पर आपस में आसपास में बैठ के खेलते हैं. Then they slowly start progressing to a little bit of simple pretend play. So we try to gauge उम्र के हिसाब से इस बच्चे की प्ले इंटरेस्ट क्या है. क्या वो खिलौनों में दिलचस्पी लेता है, या उसको he is more interested in playing with things like pens and looking at things that spin, looking at fans, So how does he or she show interest and play along with children of his or her age? So these are the 3 key areas of development that we focus on while we are thinking of autism, because these are the 3 most important areas that are impacted in autism. Over to you, Dr. Vinayan.
Yeah, thank you. Thank you. That is a very good explanation. So that means you are actually starting with whether there is a problem. That's the first thing. Okay, if you are having a concern, there is 2 things there. One is the verbal language as a whole, and the non-verbal communication. And then, as you rightly told, there are some unusual behaviors or a kind of fixated interest on something. Okay, so now we'll move on to Sonal. See, sometimes they come with real problems saying that the child is not speaking, no? So what you will try to do at that point as a kind of differentiating normalcy, the so-called normalcy, because this is a spectrum, and then you really say that something is abnormal. That is your take as a speech pathologist.
Thank you, sir. I would like to thank Indian Academy of Neurology, Ped Neurology subsection to first organize such great public awareness program in terms of awareness of autism and its intervention, and to have me here. Thank you so much, sir. So to answer your question, yes, what differentiates like normal communication versus normal speech, language, cognitive communicative development in terms of persons, children or adults or adolescents with autism spectrum disorder. So as we have seen what is autism, that they have difficulty maintaining eye contact, they have trouble initiating conversation, they have difficulty in conversing their needs, their feelings, their desires. And what we as a speech language cognitive communicative specialist or speech therapist in general, what we are called, can do is we work on play development, social communication development. We identify the child's needs, and also it's important for us as a SLP to be part of a team, which it has to be a teamwork where we develop behavior modification is important, sensory integration therapy. So OT and psychologists are important also. Along with that, when we work on a social communication development, we work on child that is he able to adequately understand, is he having adequate vocabulary. So the children with autism spectrum, they come with a varied clinical profiles. Some might have a very high intellectual quotient with the non-verbal abilities, with the gifted musical abilities, but very poor verbal intellectual abilities in terms of their reading, writing, and speaking. So when they have a trouble in social closeness, relatedness, they are more to rely on gestures. Sometimes they try to pull, they cannot ask verbally, they cannot communicate, they have difficulty in getting along with people outside, even in the home. So that is something which is abnormal, which is not that they don't want to communicate. It is neurobiological impairment, that the brain is not capable of initiating the communication, speaking, asking, arguing, expressing their love, their feelings. So that is something which is normal and abnormal. So there are different methods, different approaches which are designed to improve the person with autism and their communication need as per the child, his capabilities, his verbal and non-verbal abilities, there are effective communication systems. There are different treatment approaches in India. COMDEL, Dr. Pratibha Karan's COMDEL has a very good Indian-based system which work in a holistic intervention in autism. The Hanan model, there are different models. So what can be done? That first, understand what is a child's capability, understand how caregiver or the parent has to initiate and help the person with autism communicate. It's important that many times children with autism are misunderstood, misdiagnosed, or not well accepted. So they are even hidden from the society. They are sometimes even not allowed to mingle because they might be causing shame, so stigma. So we have a long way to go in help in terms of understanding, accepting, helping them to communicate in terms of their everyday communication effectively with simple gestures, communication boards, with importantly, how to build the communication. So this is what I would like to tell.
Yeah. So thanks, Sonal, for that introduction into the speech issues. And maybe we can come back to you with further clear instructions to parents regarding how to intervene and how to help at home. So that will be the next part of this discussion. So at this point, we will go to Tripti. We hear now, according to the current concepts in autism, the communication is one part of it, and the other one is this fixated interest, the sensory processing issues. So as an occupational therapist, what is the principle behind, or what you can just explain what is the sensory issues? Because now there is a lot of stress on this as when we discuss the autistic spectrum disorder. Yeah, you are muted.
Yeah, thank you. At the outset, I will first like to thank Indian Association of Neurology for inviting me here with all the esteemed panelists here today, and greetings for the World Autism Day. As per your question goes, yes, as the earlier two speakers said, Dr. Koili and Sonal, yes, children with autism, they come with almost, there's a research saying that around 90% of the children with autism have sensory modulation issues. And all these issues, these children are shown to integrate the inputs coming from the surroundings at a very slower speed than the normal children. And so as an occupational therapist, what we can do is promote these children's, promote the skills in these children through play. And this play is full of sensation, sensory environment. And what we actually do is we take them to different variety of experiences, of sensory experiences, and make them play in that environment and make them get an adaptive responses from them, wherein that adaptive responses can build into a social interaction and communication skills which they are lacking. We make them organized and make them assist to get their attention and the performance in an optimal level. As an occupational therapist, we work on a holistic approach. We work on their physical, their social, their emotional and cognitive abilities and the needs which are there for their child. And thereby, with sensory integration and cognitive behavioral experiences, we treat the children with autism. Thanks.
Okay, so yeah, so we will discuss that further, and
indeed.
we will come back to Alka. So at this point, see, we get a lot of children. You also might be seeing a lot of children who has got some language issues, and then there is some environmental deprivation, and they are not having any significant sensory problems, and then the fixated interest and the stereotypes. So how you are classifying at this point, and what is your advice to the parents at that point? So only the language delay and some more interest in, especially with this increased screen time and with this COVID pandemic, there are a whole lot of children which we are seeing. Okay, so how you are going about at this point?
Dr. Vinay, I think you've touched upon a raw nerve. देखिए, ये जो extra screen time के बारे में हम बात करते हैं, all of us have been speaking about it, and that Lancet article which spoke about the association with autism, there has been a lot of backlash for that Lancet article. Okay, if extra screen time could cause, as a society, as a human race, autistic features, then all adults would also be affected. So let's not directly associate कि extra screen time autism create करता है. ये गलत है. I don't want that message to go across. As a race, हम लोग we are developing towards a digital medium. अभी जो बच्चे हैं, जो अभी या गए 5 साल में पैदा हुए हैं, वो digitally native है. अगर आप देखेंगे तो उनके skills जो है, वो मोबाइल पे इतने fast रहते हैं. We are surprised at the children who come to us who even have intellectual disability as to how fast they can navigate the mobile. Our assessment tools have changed from the typical pen and paper and toys जो हम इस्तेमाल करते हैं to using the mobile as a tool और mobile वाली apps जो हैं as a tool to assess these children. तो आपका question जो था that if you have a child who comes predominantly with a language delay, आप क्या करते हो? Even if the child comes with language delay, we yet go ahead and assess for sensory issues. We check with a developmental pediatrician if there is a developmental lag in other issues like motor and adaptive. We will check with the speech therapist to see that apart from the language of communication, how is the non-verbal development occurring? We have to check all these domains because, like I said, we have to look at neurodevelopment as a holistic lens. हमें ये एक चीज नहीं देखनी है. अगर वो सब करके फाइनली ये पता चला है कि सिर्फ लैंग्वेज डेवलपमेंट में लैग है, तो क्या है? So it could be there are children who have exclusive expressive communication disorders. They have only disorders of ability to interact socially. There are children who have social phobia. There are children who have selective mutism, the parents will come and say कि घर में तो बच्चा बिल्कुल ठीक है, लेकिन बाहर जाएगा तो एक शब्द नहीं बोलेगा, आपके सामने तो बिल्कुल नहीं बोलेगा, स्कूल में तो बिल्कुल नहीं बोलेगा. तो ये सब चीजें we have to tease out, right? Again, coming back to the social media, I think it's important for us to realize that today we are shifting and transitioning from becoming only communicative through speech and language to becoming communicative through digital means. And that's not going away. We wouldn't be here today if it was going away. We're all sitting in different parts of the world and we're communicating with each other. So let's take that in the context where we can empower children to utilize social media appropriately and do further research to understand the actual association between the two. So language predominantly we will test, we will rule out everything. फिर देखते हैं अगर isolated है उस हिसाब से फिर आगे बढ़ के उसको क्या advice देना है वो हम सोचेंगे.
Okay, so it is
yeah, over to you.
Okay, so at this point, at this point, I would like to hear from Koeli also. So that the main point which I would like to
Rajesh would like to make some comment.
Yeah.
Rajesh wants to say
something. Sorry to that I actually wanted to ask a couple of questions. One is about is it not possible? I mean, we know that ये क्या होता है, autism is not वो जन्म से होता है, हाँ टेंडेंसी होती है, लेकिन उसके बाद में एनवायरनमेंट बहुत इम्पोर्टेंट रोल प्ले करता है. और ये एनवायरनमेंट जो 1 से 3 साल तक, इवन 6 महीने से 3 साल तक, जब भी हमारा जो बोलना समझना, पहले समझना बाद में बोलना जो डेवलप होता है, उसमें ह्यूमन इंटरेक्शन जो बोलते हैं, सोशल इंटरेक्शन, सोशल कम्युनिकेशन, वो बहुत महत्व है. वो मेरी अंडरस्टैंडिंग है. और ये ऐसा नहीं है कि टीवी मोबाइल से ऑटिज्म होता है, लेकिन ये इंटरेक्शन को एक्चुअली नष्ट कर देता है. क्योंकि लड़की, मैं उसका मदर फादर जो भी है काम करते रहते हैं, बच्चा रो रहा है, मोबाइल दे दिया, 3, 4, 5, 8 घंटे किया, तो इंटरेक्शन नहीं होता है. तो शायद उसका जो इफेक्ट कम्युनिकेशन पे होता है. I would like the other panelists also to give their opinion because this is an important point कि environment में जो, I mean, one of the reasons we think, it is I think कि autism जो अभी देख रहे हैं is because of excessive screen time घर में. Joe, bacha, they're not going out. They were not, so they were sitting at home and doing this all the time. What do you all think? I mean, Koili, what do you think?
Yeah, that's the same thing which I would like to ask. I think Dr. Alka is very specific. See, the thing is,
I will come back to that. Let the others answer.
Yeah, definitely. The thing is, what you are trying to say is just I would like to little explain it a little more, saying that see the autism and the classical autism, the sensory deprivation, all the other things will not develop with even with this kind of excessive screen time. That is what you would like to say. Okay, that's what I understood from whatever you told. But there are a group of children with this environmental deprivation which we are seeing. So what to call them? So Koili, how are you going to discuss this environmental deprivation where the children are immediately when they are put in a nurturing environment, they are improving? So you think there is a group like that or they are not like that? And then whether they're not putting into that actual autistic way, or what you call that, the extreme group. Okay.
So thank you. It's a very interesting conversation. Good to also see Dr. Shefali joining in. I think I'm going to take step out back a little to just understand how early children with autism are, right? And that in the first year of life, all children intuitively respond and reciprocate back to parental interactions, right? And children with autism in the first year of life, research shows that they focus less on faces, respond less to social stimuli as respect to other visual and things like that. So when parents of such children are trying to interact with their children, they do not get that same kind of responses back that would carry forth and multiply those interactions, thereby creating a back and forth of social interaction. On the other hand, such children show a preference for things that are visual, that are predictive, that are repetitive, which screens offer. All parents want their kids to be happy. So it is natural that they offer things that keep the children engaged, right? Now, to Dr. Rajesh's point, I think what we are seeing, and this is not my hypothesis, I'm going back, going on what typical literature, a lot of it comments on, and thanks, Alka, for pointing out the JAMA article. I think what we are seeing is that children with autism need much more focused social interaction. And when the screen takes over, it removes some of those opportunities, right? Now, has the lockdown contributed to it? Well, I mean, then we would have had an epidemic of autism across all households, which we are not really seeing, right? Instead, there was this wonderful article published in which there was this hospital, my memory is not that great, where they looked at 2 cohorts of children in the lockdown and saw that if anything, the communication skills of the children born in the lockdown actually had higher scores because parents were focusing on interactions during the lockdown period, right? So I'm a little worried because I'm hearing these new terms like virtual autism and things being spoken, which in fact puts the blame on the parent, right? So then it becomes that the parents are somehow responsible for inducing a condition that is actually genetic and they are born with it. So I think that's one of my concerns when we say that, because you put the child in front of the screen, this might have caused autism-like symptoms. I mean, so this is my 2 cents about it.
Yeah, so it's a very controversial thing, I'll say that. And there is a whole lot of raw literature on this, and then there are a lot of discussions going on. Alka, you would like to add?
I thank you, Koili. Thank you very much. I'm glad that we both agree to a lot of similar things. You see, we've had many children who have come to us post-lockdown with the same thing. And parents have approached us saying, my child is not communicating, my child is on the screen. Once we put them back in playgroup or they started going back to school, within 3 months, there was a normalization. Do you think autism reverses? Reverse ho sakta hai? No, please. So you said, Dr. Vinay, and you used the perfectly right word saying that is this situational. The lockdown was unnatural. Things that happen in a lockdown with a lot of people and a host of behaviors have been something that we really need to think about. Autism, ecosystems in autism are actually uterine ecosystems and genetic ecosystems before that. The reason we are seeing this plethora and the magnification is because as a species, we are doing something wrong with the maternal health. And our focus should be on perinatal health, not only physical, but emotional and behavioral, because that's where the changes are occurring. So it's much before the manifestations and the symptoms that we see. That's when we have to actually intervene and start working towards it. Ecosystems where microplastics are involved, where radiation is involved, affecting maternal health, causing PCOS. There's an epidemic of hypothyroidism, so on and so forth. So let's please focus on what autism really is and what we know about it. And this temporary shift that is there, let's try and regulate them into back into a normal being where the children were exposed to environments which stimulated them. See, we used to see the same thing with intellectual disability. They had social deprivation, and we used to call it socially deprived mental retardation at that time, right? And once you gave the child the right stimulation in the environment, it changed. So the same thing. Thank you.
Yeah, Dr. Shefali has joined. Welcome, Dr. Shefali Gulati.
Yeah, Shefali, she's back.
Thank you, sir.
She's back from a TV show. So since
I'm
you are
there
a
only.
neurologist,
Actually, I'm stating there only in that DD only. I'm sorry. That's fine.
yeah.
Thanks.
You can talk to us. No. Okay.
Yeah.
So you are the neurologist here. So we would like to. So Alka has put forward some biological aspect to the whole thing. So what do you think? What are when a child comes with symptoms suggestive of autistic tendency? What are the biological or the brain problems which can present like that? And is there any high chance of picking up a brain abnormality, or will be low chance? And what will you do about that? And what is your message to the parents? How fast to investigate?
For etiology or for autism per se? Actually,
for etiology. For
etiology.
And, yeah, for etiology, because that is the symptoms are there, but how far to evaluate at that point?
Yeah, but one thing is very.
You can speak in mixed language, Shefali.
Sure, sir. So basically, we all understand. I'm sorry, I already was committed to this DD show between 6 and 7. So I was being there, and I don't know what was discussed beforehand. But I feel when there are red flags, jo baat ho chuki hai, which has already been discussed, you can actually suspect the clues can come as early as 6 months. At 6 months of age, when you are not responding, the child is not responding to the name, when vision and hearing impairment is not there. And most of the time when the child is not being babbling at 12 months, not doing pointing and, not waving bye-bye and not using meaningful single word at 16 months or 2 words with meaning at 24 months, or has kuch bhi words has started speaking or wo bhul gaya hai. In all these situations, it is very important for the parents. If all this is there, and in other issues are and then you have to go to a doctor immediately. And it is not that many times the grandparents say ki the parents were sort of shy and started speaking late. You should not wait. So one for going for diagnosis should be jab bhi koi red flag hai, koi bhi symptom hai which is there, not occasionally but majority of the time, they have to go for the diagnosis. And when you go for the diagnostic, it has to be by a professional, and it should not be that you just directly go only to therapists. Reason being, the child has to be holistically evaluated. Pura dekhna padta hai, because you can have lot of associated problems. Ek to first the diagnosis is clinical on which they will apply tools and see what the questions जो parents को पूछेंगे and what they will observe in the child. So diagnosis is clinical. You don't have any fancy test or EEG and all that. For for diagnosis. वो हो गया. Then to understand the etiology about autism is important. So when you're talking about what Dr. Vinay is saying, the etiology as we understand of today, and I hope is basically you have काफी अनुवांशिक और genetic कारण है, but there are no clear-cut things. You may have associated problems like Down syndrome, Fragile X, tuberous sclerosis. You have many genes which have been implicated, पर अभी भी कोई एक panel नहीं है. There are a lot of new genes being found associated, for we don't have a panel as of now. Currently at AIMS also we are doing one study for last 5 years to understand कि हमारी population में क्या genes हैं, किधर हम कोई panel बना सकेंगे कि नहीं. तो as of today you don't have a battery of genetic tests to disprove it or prove it, either way, मतलब we don't have that ready. तो उसके लिए नहीं है. And you have a lot of environmental factors which range from air pollution, use of pesticides, it's used for valproate in the mother, vitamin D deficiency, having zinc deficiency. Also, we have just completed a study in which we found mercury, lead, arsenic, selenium, in सबका was raised. So there are a lot of debates going on. So abhi bhi it is, and lead, is unleaded petrol है, लेकिन illegal recycling of lead batteries अभी भी होता है. तो उसके environment में, because हम लोग सब अपना inverter car battery भेजते हैं, जब we buy a new one, we get a discount of 500 to give the old battery, which are illegally recycled. तो ये सारी चीजें हैं. Plus there is epigenetics, मतलब environmental factors which are affecting the genetic thing, when this, for a very big important example is father's lifestyle and father's advanced age. Currently we are studying on some sperm epigenome. We are studying the genetics of the father's sperm, and we have found some methylation defects. So matlab jo all, you're keeping the lifestyle of the fathers, using cigarettes, the stress, the advanced age, all that is also causing. So it is still not clear what is causing. So when you're asking me, Dr. Vinay, what will you do for the etiology and how you will go? So we have to just understand that, and there are a lot of theories which are going on, and like, we understand with the use of artificial intelligence right now, even for diagnosis, and trying to understand where the autistic children are looking at certain particular areas of the face, and you are having the DTI, matlab, some specific changes on the brain ka MRI, you're having some specific changes on DTI and functional MRI, jo specific jo sequences hote hain. So they are there to understand, and research is good, but the point is how it will affect. If koi stigmata kisi ko hai tuberous sclerosis ka, so obviously you like to get it done for the neuroimaging and all. But if you are having that will be there. So what we are doing is, if you are having, and these children may have a large head size and all, and usme you have some specifically P10 mutations and all have been associated. But for the management of the child, you do not need to go into all the etiology, but you will need to understand the etiology for telling what is going to be the trajectory uska, or if you want to go in for the next pregnancies, you have to understand that. So that is there. So we do an MRI for most of these children. We do an EEG in these children if कोई language कुछ शब्द बोलना शुरू किया है और वो regression हो गया है, because late autistic regression is commonly seen having electrical status epilepticus in sleep. तो EEG जब हम करते हैं वो sleep वाला EEG करते हैं, because उसमें कुछ particular parameters आता है जो normal भी हो सकते हैं awake EEG में, उसका specific कुछ intervention होता है, वो autism की तरह का features होता है. तो उसमें we get the EEG done in when you have a regression of language milestones and or recent जो behavior बच्चों का ज्यादा problem हुआ है. And otherwise MRI we are generally getting done for all these generally patients to understand, and they are going to have a large head. अगर किसी का facial dysmorphism है, meaning the child is looking a bit different than both the parents, in that situation, or if you're having a family history, in that situation, routinely then we go and do the RACGH initially. But in research mode, we are doing for all of them RACGH and whole exome sequencing to understand. But उससे पहले we were just doing this. And अगर हमारे को कोई suspect हो रहा है कि family history है या कोई intermittent worsening हो रहा है, failure to thrive वगैरह है, तो we do the metabolic workup. Otherwise, metabolic workup is not being done. So basically, that is how we go about and looking at it. But in research, still so many studies and gut, we have also found कि many people are doing hair and nail and all that, heavy metals and all that are being sent bahar abroad bhi bhejte hain. They are actually not needed for the diagnosis. When there is a history of any exposure, we would like to do. But abhi recent what we study, which we found, and I told you ki hame koi heavy metals raised mila hai, so that we'll have to keep looking whether we want to do this routinely. And gut, we have tried to study the gut flora. जब हम लोग सब खाते हैं एक फैमिली में सेम डाइट, तो जो हमारा इंटेस्टाइन में जो गट में जो माइक्रोफ्लोरा है वो होना चाहिए सेम. बट वी हैव डन अ स्टडी इन विच वी फाउंड कि जो ऑटिज्म का बच्चा है उनका जो गट में जो फ्लोरा है वो और जो उनका सिबलिंग का बहन भाई का फ्लोरा है उससे डिफरेंट है. So there is something, there is a gut-brain axis which has been talked about in many conditions. So इसमें भी है, इसमें now we are working out another study on trying to see probiotics and gluten-free casein feed, right? There are RCTs going on, पर वो clear नहीं है अभी भी. और अभी आज के दिन में अभी कोई और बोल रहे हैं कि gut brain के साथ endocrine भी करो. So there are lots of things which are going on, but as of now we should understand the these are the few indications which we will do, that EEG definitely, because उसका अगर recent behavior alteration है या language regression है, because therapeutic implication है. MRI to understand for the malformations. Face थोड़ा सा parent से different लगता है, तो we are doing the RACGH. That I'm talking about service mode, not the research mode. And in that is, and metabolic अगर हमें suspicion होता है तभी we are doing the metabolics. Otherwise we are and that's about how we are doing it.
Yeah, thank you, Shefali. That is, I think I'll just summarize the whole thing. So basically, as autism is a clinical diagnosis, so there is no need for doing any tests for diagnosing autism. So that is the first message. And then there are a lot of studies going on. One is the research studies, which we were, since there are no clear cause at this point, as we were discussing, there is a lot of environmental interactions and then genetic things. So that is actually not in a specific individual as a whole. So there are a lot of studies going on, but that is basically research. But in a given case, when you are having a clinical diagnosis of autism, the first and foremost is a formal clinical examination by a specialist to see whether there are some biological things. And if that is there, then take it further. If that is not there, then go for further the management in the therapies and other interventions, rather than going in for moving from one point to another for a whole lot of this different types of testing, which doesn't have a clear biological thing at this point. So can we summarize like that, Shefali?
Vinay, one more thing. We are doing BERA for all the recent onset ones, or the diagnosis. We have to do informal BERA once a hearing evaluation has to be done, because I have had patients who are referred with autism turned out to be having only hearing impairment. Although hearing impairment also along with autism bhi coexist karta hai. So it is that. And second thing, Fragile X we are doing routinely and all. Yeah. Otherwise, what you put it rightly.
Yeah. So the thing is, there is a tendency to call everything as autism at this point, and that should not be the way. So there is a kind of disabled or the differentially abled person. We have to identify what is it and then take it forward. So we'll come back to Dr. Alka. She would like to leave now at 7:30, I heard.
Yes.
Yeah. So I think so. Your parting words. What is the management when you get a child with autism? So there is a lot of people ask for some medicines. So what is at this point, when will you give some medicines for children with suspected autism, or you will not give anything?
Yeah. So like Tripti and Koili also said, there are a lot of sensory issues with these children, and at times the hyperactivity becomes so much of a problem that there cannot be penetration of the therapies. Right. So as you have the whole panel here, and the way we do the assessments is that we have all the specialists in the panel who assess, and then the therapies are initiated after everyone gives their inputs. So that includes occupational therapy, because we are a resource crunched country, and one of the best modalities that we have and the best specialists in autism are our speech therapists and our occupational therapists. For behavior therapy, we have psychologists. But at times we find that we are not able to penetrate with the therapies because the child is just not able to get that focus. The child, all the sensory inputs are bothering the child so much that they will either keep being in that world of their own, looking at the fan or playing with the toys or spinning something, and stay away from anything which is stimulating them. So we start what we call as sensory inputs or sensory diet at home. And we start with medication, which we don't give necessarily for as long as we give for most of the other disorders like ADHD, which needs it for a pretty long time, 2 years and more, sometimes lifelong. What we usually do is whenever the children have the sensory bursts or the vulnerable periods, we introduce medication, which may be medication for the ADHD. There may be very low dose antipsychotics, because particularly aripiprazole is something which is a dopamine stabilizer. It's not a dopamine blocking agent, and it works on nuclear targets. So for autism per se, it is highly indicated, and there's a lot of evidence based in it. So once we initiate the treatment, what happens is this child becomes a lot more amenable for the therapy to penetrate. And once the therapies penetrate and start working, then we slowly wean off the medication. However, in the trajectory of this child, we would find periods of developmental spurts and also periods of what we call as developmental stress. For example, adolescence, puberty. Then you might have these behaviors again worsening. You would find that they are what is commonly called as, they're regressing, and they're having again the similar symptoms which we are getting in. Again, you would find that there is a lag, the speech, the nonverbal, the PEX is not working, ABA is not working. So what do we do at that time? Again, we reintroduce medication. We try and see that all the causes why the child is having difficulty is brought down from a neurological perspective. So we are working at those nuclear targets, bringing that down. So again, the therapies penetrate. There may be a different set of medications, particularly when we see the pubertal spurt and the adolescent spurt, we find anxiety is a lot there, and that's when we use anxiolytics or antidepressants to work. So yes, you do need often to use medication also and therapies, and this is a multimodal treatment. And the last thing I want to say is that educational inputs are equally important. So at NIRE is one of the leading testing centers for educational inputs. We again have a multidisciplinary team, and when we give them that certificate, we actually test every 2 years, because that's how rapid the change is with the inputs. And the change of what they require at a school level also changes. And these children now can avail of the disability certification, though I don't like the word, under the UDID certificate. So once you have that card, throughout India, it is to be accepted, which becomes much easier for the child to avail of these benefits.
Okay, so you put it very clearly that there is no specific medication here, unfortunately, for autism.
It doesn't disappear.
So, yeah. So we hope, see, at some point in time, we would be able to, but we don't know at this point. Okay, at this point, there is no specific magic cure is not there, but we can have a judicious use of medicines. Can we put like that? Okay. Yeah. So in a multimodal therapeutic environment with
Vinayan,
yes,
can we have a parent with
so that
so
I
we
think
can have some comments from her, and then we take the discussion forward.
Yeah. So I think Dr. Ms.
Priyadarshini, you there? Yeah, Priyadarshini is an All India Radio Station Director in Telangana, and Dr. Alka wants to make something.
I will leave. I have another session starting.
Okay. Thank you, Dr. Alka. Thank you so much for being with us. Thank you very much.
Thank you for joining.
Bye-bye. Bye-bye.
Yeah. Ms.
Priyadarshini.
Namaste, good evening everyone. Thank you Dr. Meshram sir, आपने मुझे यहाँ बुलाया. मेरा बेटा है अभी now he is 25 years old. तो जब वो 2 साल का था, he is my second child, पहली बेटी है, और वो जब 2 साल का था, means before 23 years, तब मुझे लगता था कि इसका कुछ प्रॉब्लम है, क्योंकि मैं जब ऑफिस से आती थी तो जैसे बाकी बच्चे माँ के तरफ आते हैं, कुछ इमोशंस ही नहीं दिखते थे मुझे, और बात नहीं करता था, और कम्युनिकेशन मोस्टली नॉन वर्बल होता था, जो टिपिकल जो लक्षण आजकल बताते हैं ऑटिज्म के, कि उंगली पकड़ के चीजें दिखाएगा एंड ऑल दैट. और बात नहीं करता था, और मुझे लगता था कि इसमें कुछ तो भी प्रॉब्लम है। एंड सेकंडली जब उसको दांत भी आए तो वो च्यू नहीं करता था, और हम उसको मिक्सर में से ही फूड, सेमी सॉलिड फूड उसको देते थे, और उसमें इतना सा शक्कर का दाना भी आया तो ही यूज्ड टू वॉमिट। तो ये सब चीजें हो रही थी। तो बिफोर 23 इयर्स मैंने बहुत पहले पेडिट्रिशियंस के पास उसको लेके गई, तो वो मुझे वहां पे कुछ रिजल्ट नहीं मिला। कोई बोलता था बच्चों को समय दो, कोई बोलता था उनको गार्डन में लेके जाओ एंड ऑल दैट। देन मैं नागपुर के कोई टॉप के साइकेट्रिस्ट के पास गई, फिर उनको मैंने पूछा कि ये जो मेरे बेटे को हो रहा है वो क्या है, एंड तो उन्होंने कहा इसको ऑटिज्म कहते हैं। फिर उसके लिए नागपुर में डॉक्टर जी शशिकला मैडम थी, उनके थ्रू उसको ट्रीटमेंट शुरू की, एंड एट द एज ऑफ 2 इयर्स, एंड स्पीच थेरेपी भी उसको शुरू की। और ऐसा करते करते फिर उसको नॉर्मल मराठी स्कूल में डाला हमने, क्योंकि बाकी जो स्कूल्स थी वो उसको लेने को तैयार नहीं थी, और बहुत हाइपर एक्टिव था, और उसका कुछ कम्युनिकेशन नहीं होता था। स्कूल में भी अकेले अकेले रहता था, एक दो बस फ्रेंड्स थे। कभी कभी क्लास से उठकर पूरे स्कूल में राउंड मारता था वो, उसके टीचर्स बताते थे। लेकिन ऑल थ्रू द वे उसके टीचर्स का, स्कूल का, कॉलेज का मुझे बहुत कोऑपरेशन मिला, एंड उसको हमने फिर 8th क्लास स्टैंडर्ड के बाद, अच्छा ऑल थ्रू द वे उसके लिए होम ट्यूटर रखा था। बाद में 8th स्टैंडर्ड के बाद उसको सेमी इंग्लिश मीडियम दिया था। उसका खाने का जो प्रॉब्लम था वो नियर अबाउट 6 साल का हुआ तब तक चला उसको। मीन्स इसलिए हमको बहुत दिक्कत होती थी, हम कहीं भी जाए तो फिर उसके लिए सेरेलैक या कुछ ऐसा मैश्ड फूड या ऐसा कुछ उसको देते थे, और वो एक प्रॉब्लम थी। देन उसका स्पीच ठीक नहीं था, तो 7 साल के बाद वो बोलने लगा था। यानी इनिशियली मैं तो बहुत रोती थी कि बच्चा कभी बात करेगा नहीं करेगा, और अभी ये सब मैं आपको बहुत शॉर्ट में बता रही हूँ, लेकिन इट वाज अ लॉन्ग जर्नी और बहुत सारे एक्सपीरियंसेस थे। एंड स्कूल में सेमी इंग्लिश था, मैथ्स एंड साइंस इंग्लिश में था, तो घर में मैं साइंस के, मैथ्स के बुक्स में जो प्रिंटेड मैटर होता था उसके सामने मराठी में लिखती थी, सो दैट ही कैन अंडरस्टैंड वो क्या पढ़ रहा है। वो 10th भी ठीक से पास हो गया। देन उसका हमने टेस्ट वेस्ट किया था, तो फिर उसको 11th 12th कंप्यूटर साइंस दिया कि वो कंप्यूटर्स एंड इसमें बहुत अच्छा था। फिर उसके बाद ट्रायल एंड एरर पे उसको हमने कंप्यूटर इंजीनियरिंग में डाला, यही सोच के अगर कर पाया तो ठीक, नहीं तो हम और कुछ देंगे। तो उस टाइम ही उसने बहुत अच्छे से, बीच में कुछ प्रॉब्लम आए टॉपिक्स के, लेकिन उसने किया। लेकिन ड्यूरिंग कॉलेज लाइफ उसको ये प्रॉब्लम हुई थी कि वो बहुत ही इनोसेंट बच्चा था। मीन्स 18 साल का था, 20 साल का, लेकिन ही वॉज लाइक, उसका मेंटालिटी लाइक 12 साल के बच्चे के जैसा था। उसको कॉलेज में जो नॉर्मल बच्चे हैं इंजीनियरिंग के, तो उसको 1 साल उसको बहुत तकलीफ हुई। उसको बोलते थे कि अरे तू सिगरेट नहीं पीता क्या, अरे तू बियर नहीं पीता क्या, अरे तू लड़की के साथ जाता नहीं क्या, एंड ऑल दैट। एंड उसको गंदे गंदे वीडियोस भेजते थे, तो उसने कॉलेज जाना छोड़ दिया। एंड एक बार फिर मुझे लगता था कि क्या प्रॉब्लम है, फिर आई फाइंड आउट ऑल द प्रॉब्लम एंड ये सब। तो 1 साल वो गया ही नहीं, कॉलेज नहीं गया, इतना सेंसिटिव था कि नहीं गया। एंड पूरे 10 पेपर्स उसके रह गए। लेकिन बाद में नेक्स्ट ईयर उसने पूरे 10 पेपर्स एक झटके में उसने पास किए। एंड उसको लेके फिर आई एम फ्रॉम नागपुर, अभी करंटली 3-4 साल हो गए मैं हैदराबाद हूँ। उसके लिए मैं हैदराबाद आई, एंड हैदराबाद में कुछ कोर्सेज उसको दिए रिलेटेड टू कंप्यूटर साइंस। एंड मुझे बताया गया कुछ डॉक्टर्स ने कि ही वाज द फर्स्ट कंप्यूटर इंजीनियर इन दैट रीजन, वहां तक वो पहुंचा। एंड यहाँ पे फिर हमने ट्राई किया उसके जॉब के लिए, एंड आई एम वेरी हैप्पी टू टेल कि उसने पहला ही इंटरव्यू दिया, और उसने वो इंटरव्यू क्रैक किया, और अभी वो सीनियर डाटा एनालिस्ट करके बैंक ऑफ अमेरिका कॉन्टिनम में उसको जॉब मिला, ही इज वर्किंग देयर। लेकिन ऑल थ्रू दिस वे हमको बहुत प्रॉब्लम आए। लोगों को लगता था कि, बहुत बार लगता था कि दिस लेडी इज लाइंग करके, कि अरे लड़का तो नॉर्मल दिखता है, अच्छा दिखता है, ये लड़के को कोई प्रॉब्लम नहीं होगी, या फिर आपके बच्चे को प्रॉब्लम है, आपका बच्चा साइकिल कैसे चला लेता है, आपका बच्चा स्कूटर कैसे चला लेता है, मीन्स ये टाइप के लोगों की क्वेरीज होती है। इवन पहले उसको सर्टिफिकेट नहीं मिलता था, जो सर्टिफिकेट मिला था गवर्नमेंट मेडिकल से तो वो मेंटल रिटार्डेशन का देते थे, और जब शुरू हुआ ऑटिज्म का सर्टिफिकेट लेने को, एट दैट टाइम ऑल्सो वहाँ के एक पेडिट्रिशियन थे, उन्होंने कहा कि ये ऑटिस्टिक है नहीं ये बच्चा। तो एट दैट टाइम मैंने फिर उनको बहुत नम्रता से बोला कि मैडम अगर इसको ऑटिज्म नहीं है, नाउ ही इज 18 years old, अगर इसको ऑटिज्म नहीं है तो अब तक जितने भी डॉक्टर्स ने उसके सर्टिफिकेट दिए हैं या जो भी डॉक्टर्स ने लिख के दिया है कि ही इज ADHD है, ऑटिज्म है, तो आप प्लीज बोलिए कि ये सब डॉक्टर्स ने आज तक जो भी लिख के दिया है वो सब गलत है। मैं वो डॉक्टर्स पे केस करूंगी कि इन्होंने मेरे बच्चे के बारे में झूठ बोला, और आप जो बोल रही है कि इसको ऑटिज्म नहीं है तो वो हम मानेंगे, आप मत दीजिए सर्टिफिकेट। तो उसके बाद फिर उन्होंने कुछ नहीं बोला, और वो UDI सर्टिफिकेट बहुत मुश्किलें आई ऑल थ्रू द वे, एंड अभी भी वो बहुत सोशली ज्यादा इंटरेक्शन उसको अच्छी नहीं लगती, घर में ज्यादा लोग आए अच्छे नहीं लगते, अभी वर्क फ्रॉम होम ही था तो और उसका आई कांटेक्ट अभी भी नहीं होता है उसका आई कांटेक्ट, एंड जो ऑटिज्म के जो साइंस थे वो सब उसमें थे, स्पीच डिले ये सब था, एंड अभी है कुछ वर्ड्स के मीनिंग उसको नहीं समझ में आते, कभी कभी कुछ भी बोल जाता है तो उसको समझाना पड़ता है कि नहीं ऐसा नहीं ऐसा, लेकिन टेक्निकली वो बहुत इंटेलिजेंट है, एंड फोटो मेमोरी बहुत ज्यादा शार्प है। अभी हैदराबाद में अगर कोई उसके फ्रेंड नहीं है, लेकिन हैदराबाद उसने अकेले स्कूटर से इतना एक्सप्लोर किया कि ही नोज ईच एंड एवरी रोड, एंड पूरा गली उसको हैदराबाद की पता है, फोटो मेमोरी है, ये है, डेट्स उसके ध्यान में रहती है 20 साल पहले के भी, एंड रिलेटेड टू टेक्नोलॉजी वो बहुत ज्यादा होशियार है, लेकिन लैंग्वेज का उसका प्रॉब्लम था, एंड खाने का भी अभी खा लेता है अच्छे से, लेकिन पहले 6 साल तक हम उसको पूरा मिक्सर का फूड देते थे, एंड ये ओवर सेंसिटिव भी है, इमोशनल बहुत ज्यादा है, एंड एग्रेशन भी है, एग्रेसिवनेस बहुत आ जाता है, तो ये ऐसा है, लेकिन अभी काफी फर्क है, बहुत आगे आ चुके हैं हम लोग, और इसमें मुझे फैमिली का भी सपोर्ट मिला, एंड स्कूल में उसके टीचर्स का, उसके प्रोफेसर्स का बहुत सपोर्ट मिला मुझे, और उसके कारण यहाँ तक आ गए। एक्चुअली मैंने बहुत लगे, लेकिन बहुत सारे बहुत प्रॉब्लम्स फेस किए, और ये बच्चे को समझने के लिए मैंने भी खुद फिर MSc क्लिनिकल साइकोलॉजी किया कि मैं और इसको समझ पाऊं बच्चे को, और जैसा है वैसा चल रहा है, और लेकिन ये सब आज मैं आपको बोल पा रही हूँ, लेकिन 20 साल पहले मैं बहुत रोती थी, एंड वो जो नॉर्मल होता है कि व्हाई मी, ऐसा क्यों हुआ मेरे बच्चे के साथ ही क्यों हुआ, एंड कभी ये मुझे बात कर पाएगा, बहुत एंजाइटी होती थी कि मीन्स हम लोगों के इस दुनिया से जाने के बाद ये बच्चे को कोई देखेगा, कैसा होगा इसका, ये जो नॉर्मल पूरा एक होता है बच्चों को लेके, किसी भी डिसेबल्ड बच्चे के पेरेंट्स को जो भी स्ट्रेस एंड ऑल दैट होता है वो था, एंड ये सब चीजें हैं, एंड उसको भी लगता था कि मेरा कुछ अलग है, मैं कुछ नॉर्मल नहीं हूँ ये हूँ, लेकिन अभी भी उसको अच्छा नहीं लगता ज्यादा सोशलाइज होना, सिलेक्टेड 2-4 फ्रेंड्स है बस, वो उनके साथ ही इंटरेक्शन करता है, या रिलेटिव्स भी बहुत उसको कंफर्टेबल नहीं लगता है, घर में अगर बहुत लोग आ गए तो ये नहीं करते, रूम बंद कर लेता है, और ऐसा
थैंक यू वेरी मच प्रियदर्शनी, और आपको बहुत बहुत शुभकामनाएं उसकी आगे की प्रगति के लिए। थैंक यू वेरी मच फॉर बीइंग विद अस। Vinayan, please.
Thank you, Ms. Priyadarshini, for sharing your struggle and your journey of as a mother and a caregiver of a child with autistic tendencies. And that opens up a lot of questions. I think Koeli would like to talk a few, basically 2-3 things which we are not discussed. One is the stomach issues, which and the food intake and the related difficulties, which many parents say when a child with autism. So that is one thing. And then the other thing is this islands of excellence, where which the Pedarsni was now explaining, like there are some specific things which he was excelling. So what is your take, and how will you explain that to the parents who are here, and how to explain that?
सर मैं पेरेंट्स को यही बोलूंगी कि जितना अर्ली डायग्नोस कर सके, बहुत सारे पेरेंट्स की मैं मुझसे पूछते हैं, काउंसलिंग करती हूँ मैं उनकी, मुझे यही लगता है कि जितना अर्ली वो बच्चे का कुछ लगे, उतना जितना अर्ली उनका ट्रीटमेंट शुरू किए जाए उतना अच्छा है। और कभी कभी मुझे भी लोग बोलते थे मेरे बच्चे के लिए कि अरे कुछ कुछ बच्चे लेट बात करते हैं, और मुझे बोलते थे कि आपको ही कोई प्रॉब्लम है, इतना क्यूट बच्चा है, उसको कोई प्रॉब्लम नहीं है, आपको ही कोई प्रॉब्लम है, आप वो बच्चे को लेके डाउट्स ले रहे हो मन में। तो और बहुत सारे पेरेंट्स बताते नहीं है कि कुछ बच्चे को, या फिर 6-7 साल के बाद वो बोलते हैं कि प्रॉब्लम है। तो आई थिंक कि they should accept जो भी है and start early treatment, and उन्होंने hesitate नहीं करना चाहिए। and बहुत सारे parents छुपाते हैं कि बच्चों को कुछ problem है, social उनको लगता है, कुछ शर्म आती है बताने में, ऐसे भी parents मैंने देखे हैं। तो मुझे लगता है वो हमारा बच्चा है, हमने we should do our best, जो उनको जो फील्ड में वो अच्छा कर सके उतना उनको लाने को। एंड ये मेरे बच्चे का जो ईटिंग प्रॉब्लम था सर, मैंने पूछा था, वो उसकी जो जीभ थी वो फोल्ड हो जाती थी, जब उसको हम खाने को देते थे तो उसकी जीभ छोटा था, ऐसे फोल्ड हो जाती थी, एंड हम स्पून से डालते थे एंड वो उसको स्वॉलो करता था, और उसमें इतना सा भी कुछ भी सॉलिड, इतना सा भी पार्टिकल आया तो वो पूरा वॉमिट कर देता था। मैंने डॉक्टर को पूछा था इसको क्या कहते हैं, तो मुझे पता नहीं, लेकिन डॉक्टर्स ने वर्ड बताया था टंग एपरेक्सिया करके। तो वो 6-7 साल तक चला, उसके बाद वो स्टार्टेड च्यूइंग फूड। अर्लियर दांत थे, सब थे, लेकिन वो नहीं खा पाता था, वो भी एक प्रॉब्लम था। तो ऐसे जो भी प्रॉब्लम्स है, डिफरेंट प्रॉब्लम्स we have to face.
Thank you for giving that strong message that early identification and early intervention is the key here. And Dr. Koili, you would like to add anything here? Based on the story, a true story here.
Yeah. And बहुत ही पावरफुल स्टोरी है प्रियदर्शनी जी, और आई थिंक जो सबसे ज्यादा जरूरी है कि आप जैसे माता पिता जब आगे आते हैं अपनी स्टोरी शेयर करने के लिए, तो कई पेरेंट्स को हिम्मत मिलती है आपकी स्टोरी सुन के। और मैं और एक चीज कहना चाहूंगी, जो डॉक्टर विनय ने पूछा अबाउट दीज आइलैंड्स ऑफ एक्सीलेंस, तो हालांकि हमने प्रियदर्शनी जी से सुना उनके बच्चे के बारे में, जो बहुत सारी खूबियां उनमें थी। तो हमारे पास जब पेरेंट्स आते हैं तो बहुत बार वो पूछते हैं कि डॉक्टर इसमें वो कौन सी सवांड स्किल है, वो माय नेम इज खान में कुछ ये था, तो मेरे बच्चे में भी होगा ना, हर ऑटिस्टिक बच्चे में होता है, इसको ना कैलेंडर आता है ना इसको राजाओं के नाम आते हैं। सो आई थिंक देयर इज a little bit of confusion कि every autistic बच्चे को कुछ सवांड स्किल होना चाहिए। तो जैसे आम जनता में भी excellence is limited to a percentage, so that is how it is with all people, right? और but at the same time हर बच्चे में भी there is a profile of strengths and challenges. तो जो बच्चा कंप्लीटली नॉन वर्बल है, वो कुछ नहीं कर पाता है, पर वो शायद एक जगह पे बैठ के चीजों को सॉर्ट कर सकता है, या वो कलर्स देख के वो पहचान सकता है कि ये क्या है, एंड दैट इज हिज स्ट्रेंथ, राइट? तो हमारे हम जो सभी लोग हैं, ये बहुत जरूरी है हम देखें कि हमारे बच्चे में उसके प्रोफाइल में खूबियां क्या है, instead of trying to desperately seek that one quality that will make a career out of him. I think that creates disappointment. And instead, if we focus on all the things that our children do well, we can build on them. And I think यहाँ पे तृप्ति और सोनल कहीं बेहतर कंट्रीब्यूट कर पाएंगे कि आप लोग किस तरीके से स्ट्रेंथ्स बेस्ड अप्रोच यूज करते हैं इंटरवेंशन के लिए. तृप्ति, अगर आप कुछ ऐड करना चाहें यहाँ पर.
Yeah, definitely.
Yes, sure. Yeah, I completely agree with Dr. Koili. These children, when they come, we have to tap on the I will say splinter skills. These children are very, very good in few areas, and we, along with the parents, need to tap that skills and build on them rather than focusing on other areas, because that will give them the self-confidence to work over it, and basically that will reduce the stress levels for the child as well as the parents, and that can give you a better improvement and better success for the child.
Yeah. So anything else you would like to add regarding these issues with feeding? She was telling that
yeah.
any specific techniques you would like to work, and any suggestions for the parents?
As far as Ms. Priyadarshini madam has said, the issues which she said, I will relate from the sensory aspect. I would say that there can be an oral sensitivity issue as well as with that tongue ataxia, what she was talking about. There can be an oral sensitivity issue, which is leading to that gag which he is showing. And so the oral sensitive treatment with various textures, with gradual textures, introduction of textures and massages can help that child with feeding issues. So it can be related to the sensory aspect as well.
I would like to add to that. हम काफी सारे देखते हैं कि बहुत सारे बच्चे जो शायद कुछ चीजें खा पाते हैं अच्छे से, लेकिन कुछ चीजें जो वो खा पाएंगे, चबा पाएंगे, वो बिल्कुल चबा नहीं पाते, लेकिन वो वॉमिट कर देते हैं. So hyper gag, hypersensitivity, dyspraxia are the terms which we see from the patients and the doctors who refer. So speech pathologist with a swallowing ability intervention and OTs do very importantly add up to the person with a small child or a toddler or a preschooler. So it's important that we understand that oral sensitivity, how do we work on that? So आपको क्या देखना है, हर एक बच्चा जो जिसे मिंगल नहीं कर पाता है, बोल नहीं पाता है, समझ नहीं पाता है हमें क्या चाहिए क्या नहीं चाहिए, लेकिन उसे क्या चाहिए वो उसे पता है. और आप एक माँ होकर, पापा होकर आपको पता होता है कि what my kid needs, what he or she is really liking and able to chew, gulp very well without gagging, vomiting, what is not good for her, what makes her hyperactive, through temper tantrum, जैसे कि मीठी चीजें हो या फिर खट्टी चीजें हो या फिर कुछ क्रंची चीजें हो. तो आपको देखना है कि क्या खाकर ये बिल्कुल मुझे पसंद नहीं है, ये देखता है, और क्या खाना वो पसंद करता है. और ये सब ऑब्जर्वेशन बहुत इंपॉर्टेंट है, ना कि उसे आप फोर्स करें. और उस हिसाब से आपको कोशिश करनी है कि स्पीच थेरेपी, ऑक्यूपेशन थेरेपी को बताए कि आप क्या खिला रहे हो, क्या खिलाना चाहिए और क्या दिक्कतें हैं. So many people, I have seen many speech pathologists and OTs, if they are not given an appropriate input on a feeding ability of a child, then they may not work on dyspraxia. But that's a very important aspect to work on, that a kid develops feeding abilities, and feeding in autism is different than a feeding in any the retardation, stereotypical children, or any other child with a neurological insult or acquired brain injury. So it's important that we understand in terms of proper behavioral intervention. Is it a phagophobia? Is it actual dyspraxia? ये बहुत important होता है. Coming to Priyadarshini ma'am, I really congratulate you that you have encouraged your kid, you have accepted the kid, tried seeking the help. आपने बाकी बच्चों की तरह कंपेयर नहीं किया कि मेरा बेटा बोल नहीं पाता है, मेरा बेटा ये नहीं कर पाता है, बट आपने उसको एक्सेप्ट किया, उसे हर एक चीज, हर एक कोशिश की कि वो नॉर्मल बच्चों में जाए, के लोगों में मिंगल करे. और जहां तक है कि सोसाइटी एक्सेप्टिंग पीयर ग्रुप एक्सेप्टेंस बहुत कम है. अगर आप टीचर्स को बताएंगे तभी वो कोशिश करेंगे, नहीं तो वो ADHD, हाइपर एक्टिव, हाइपर इम्पल्सिव, socially very miserable, these terms are really bad, derogatory. So आपको देखना है कि आपके बच्चे में क्या है, और आपने कोशिश की कि उसकी खूबियां जाने. आपने उसे सही ट्यूशन भी दिया, घर पे भी ट्यूशन लिया, स्कूल में भी हेल्प किया. I feel all the parents who are watching this program should make sure that every kid is different. अगर उसे कुछ नहीं आता है तो वो क्या कर पाता है वो देखना है. So find out strength and abilities than just labeling what he or she cannot do. That would be helpful. Not all kids can be Rain Man or Shah Rukh Khan, Main Hoon Na. Not all kids could be versatile musicians, pianists. So I would feel that have your child look at him as a normal child and help him to be more normal. And it's important that we understand what he or she is capable. But unlike you help them learn, that's very important. अगर आप उसे सिखाएंगे नहीं, अगर आप कोशिश नहीं करेंगे कि क्या सीख पा रहा है वो, क्या सीख नहीं पा रहा है, तो आपको कैसे समझ आएगा कि उसको क्या capable है, क्या कर सकता है. So that is something I feel it's important, that our testing is also needs to be on a functional abilities testing. A lot of these test tools are only checking what he cannot do, what she cannot speak, what she cannot do. So the ICF framework is important, and throughout my practice, I've always seen many children with seizure disorder, with this kind of behavior LKS, some children with autism with mental retardation, some children with higher gifted skills, but majority of them in rural India with our poor literacy, poor socioeconomic status, they are actually deprived of background which they should be able to get adequate help from the beginning. So we need to really work on that. And Priyarashini ma'am, 3 cheers to you. Thank you.
Thank you, ma'am. I want to say one thing. I want to add one thing. Hello?
Yeah, you can.
Sir, I just remembered कि जब वो छोटा था 2 साल का, and at that time 2 or 3 pharma companies approached me, and they said कि हम एक नया medicine we are trying, तो on trial and error basis like that, तो please allow us to give your child this medicine. तो I refused कि मुझे डर लगा कि नहीं ये कौन सी मेडिसिन है, क्या है. नहीं, वी आर इन्वेंटिंग सम मेडिसिन फॉर ऑटिज्म, तो आपके बच्चे को हम स्टार्ट करेंगे. तो आई रिफ्यूज्ड दैट थिंग. एंड सेकेंडली बीच में बहुत सारे कॉल्स आते थे कि स्टेम सेल थेरेपी आप दीजिए बच्चे को. बाय दैट टाइम वो बड़ा हो गया था, तो मैंने उसको आज तक कोई मेडिसिन नहीं दी. Not allopathic, not homeopathic, not Ayurvedic, nothing like that. Without medicine, जो जैसा चल रहा है बस वैसा ही किया. एंड वो जो मेमोरी का मैं बोल रही थी, वो जस्ट उसको अभी भी है कि कैलेंडर एक बार कैलेंडर देख लिया तो ही नोस कि 2022 में कौन से दिन कौन सी डेट आती है. एक बार ग्लोब देख लिया तो ही नोस कौन सी कंट्री कौन से एक्सिस पे है, या फिर पूरा जितने भी है एंड वर्ल्ड की पॉलिटिक्स एंड ऑल दैट, एनी सोशल इशू राइट फ्रॉम कोई भी इशू हो, इंटरनेशनल पॉलिटिक्स या जो भी है. मुझे भी कभी कभी हैरानी होती कि हाउ मच जनरल नॉलेज ही हैज गेन्ड एंड फ्रॉम वेयर. तो दैट थिंग आल्सो आई वांट टू ऐड. ये भी चीजें बच्चे में है, एंड आई डिडंट गिव एनी मेडिसिन टिल नाउ.
Yeah, thank you, Priyadarshini ji, again pointing out another major issues of this going for magical cures and then some kind of interventions which are not scientifically validated at this point. Okay, so there are 2 people who have raised hands. So you would like to say something? Gautam Ganguly.
Bindu is there.
Yeah.
Bindu, yes. Bindu, you can go ahead. Please unmute yourself. Okay, I think Gautam Ganguly, would you like to say something? Make some comments?
Hello.
Yeah,
Hello.
we can hear you.
Yes, actually, I was just hearing the whole topic, and the most interesting one was what was told by Priyadarshini Madam. And I think I respect her from the heart of my heart. I request all parents of autistic individuals should form a support group and enrich other people's lives. I think that is the best message that I could get from here. Of course, we as clinicians will try to empower them with whatever information that we have, but telling the experiences from their own lives is the most important and lifelong message that other parent also can have in upbringing their child. That's all that I want to say. Thank you for giving me the opportunity.
Yeah, thank you, Bindu. So, Gautam Ganguly.
Oh, am I audible?
Yes, sir.
Sir, am I audible now?
Yes, Gautam. Yes, go ahead, Gautam. We can hear you.
So thank you, sir, for arranging this such a good awareness program with also the parents of this autistic child. And I also today try to aware some of the parents, and I think this awareness program, not only this autistic child, like other awareness programs, should be continued. And it's a challenge of the parents, and we being the neurologist should continue this days. I thank you, our president, Dr. Nirmal Surya, and thank you, sir. Thank you, Dr. Messam, and all the participants for this excellent program. It's an excellent, and it should be continued. That will be a very, very beneficial effect. Thank you, sir. Okay.
Thank you.
Yeah,
one more. Thank you, Gautam.
Okay.
Bhuvneshwari Mehere. She
Yes.
is the principal in the
Yes.
college. Yeah.
Am I audible, sir?
Yes. Very much audible. Yes. Bhuvneshwari,
Thank
go
you,
ahead.
sir. Thank you very much for organizing such a nice program on autism. I have one problem, sir. Here, after Shashikala madam, we are not getting any proper renowned clinic for this. Priyadarshini madam, as Shashikala madam has left, now we are so much, means we are not getting help. My niece is, we are not knowing about her. She is of 3 or 4 years. And she is basically, I thought after seeing her that she is autistic or either may have cerebral palsy, because the parents are not showing me the reports and they stay at Wardha. She is my sister-in-law's niece. So we are very much in a problem. So I want to talk to Chandrasekhar sir on this problem. Where to get her, sir?
Yeah. I will let you know, and I will guide you accordingly. Thank you.
Okay, sir. Thank you very much, sir. And thank you for this organizing such a nice event, sir. Thank you very much, sir.
Thank you.
Thank you. Now I think it is time. Thanks to all the participants and all the panelists, Dr. Koeli, Dr. Alka, Dr. Shefali, and Sonal, and so with I would like to thank all of you, including Priyadarshini ji, for giving a kind of very enlightening story of a real life story. So over to you, sir, for the concluding remarks. Neslam, sir.
So thank you very much.
Yeah.
Chandrasekhar, you have got something?
Thank you so much, all.
So I must say that this program was organized in last 3 days' time. I think this is the quickest and shortest time duration where we organize a program. And I must say that Minian and team and Meshram has taken a lot of pain in last 2 days to get the things organized. And this really has a lot of things. I must say that Priyadarshini, hats off to you. You kept on fighting. You're a real true star to fight for your son. And I think you need mother like you to take forward, because it is ultimately the family and the parents. And among the parents, it's the mother who is being the leader. If she is the one who takes the things in her hand, I'm sure every child will do very well. The enthusiasm you've shown to do the MSc, to take it forward and refuse the stem cell and other therapy, which many parents are glued into, to spend the thousands of rupees and get no result. So I compliment you, and I think you are a role model. Somebody should make a movie on you, a small short movie we should make, and that will really. I think I'm very serious. Chandrasekhar is the man who can make a short movie on your character with your child fighting, and that could go in one of the WHAP thing or short film festival. I think it's a serious offer. Don't take it as a joke. Thank you very much. Mishram, over to you to finish up.
Dr. Shefali wants to make some comments.
Yeah, sir. Sir, just wanted the message जो parents को जाना चाहिए. All 5 fingers are not the same, so these children are different. We have to understand that, and we have to look at the positivity what our child can do and not what the child cannot do. And everybody's glass is not completely full. And the theme for this today, for the World Autism Day by UNICEF, is UN is basically inclusive quality education for all. But I feel inclusion in society is more important and very important, and the humanistic aspect of things have to be seen. And when we feel shattered and lonely, I think the hope says whispers die one more time. So we should all move ahead forward and boldly face the challenge. And we all should, as professionals, hold hand of all the parents, giving them evidence-based guidelines for what is available and be available to them. And hats off to you, Priyadarshini ma'am. Thank you so much, sir.
Thank you, Dr. Shefali. And this year's theme is actually inclusion in society and profession. So that's a very important thing. And I think before we end, I would like to share one video. Can you see the video of this another autistic child?
நேவி அதிகாரியுடைய மகள் இன்னைக்கு கடந்து வந்திருக்காங்க. 13 மணி நேரத்தில் பண்ணிருக்காங்க. அது பெரிய சாதனை. இது மற்றவங்களுக்கு ஒரு புத்துணர்ச்சியும் ஒரு ஊக்குவிப்பையும்
This was another inspiring and interesting story. A girl with autism, and we had a very interesting and inspiring story by Priyadarshini about her son, and I'd like to congratulate Priyadarshini and the child. You know, the journey that she has covered, I think, is phenomenal, and it would inspire, and she would act as an advocate for this kind of problems for the society. It's a great work and good example. So I just remember today, and I requested her to join, and thank you for joining at such a short notice. I knew her because she had recorded so many of my interviews on All India Radio about brain health, and we have been, doing publication and activities for last 30 years through the TV and through public programs and through All India Radio. And I would like to thank all the panelists, Dr. Alka Subramaniam, Dr. Shefali Gulati, Dr. Koili Sengupta, Dr. Sonal, Dr. Trupti, and for wonderfully conducting today's session, Dr. Vinayan, and also I would like to thank Dr. Brajesh Udani, and of course the IN President, Dr. Nirmal Surya, for giving me this opportunity to organize this session, and Dr. Vinayan did a wonderful job of moderating the session and spreading the awareness and information about this very important aspect. There was a very interesting movie called Lottery, and we had shown in the film festival. Swanand Kirkire had acted in that movie as an autistic person. So there are so many good movies, good information, and you can know through this, Rain Man, and you can try to identify people and you can help people. I have some patients with Savant syndrome, and I think today's session was extremely wonderful, and that the session became wonderful because Priyadarshini Raut was there to share her story. And would like to thank everyone who joined for this today's session, and thank you very much once again. And on 11th of April, we'll have a session on same time at 6:30 p.m. a session on Parkinson's disease. So there will be another interesting and public awareness program in last 7 days. Actually, this is the third program. On 24th, we had public education program on tuberculosis of brain. On 26th, we had the Purple Day, so awareness program on epilepsy, and today on autism. And on 11th, we'll have on Parkinson's disease. So these sessions will continue. So if you have any questions, you can put your questions on the IN website. And I would like to also thank Bindu and Gautam Ganguly and Bhuvneshwari Mere, who is a principal at the Best College in Nagpur, and for joining, and everyone else for their comments and contribution. Thank you very much.
Thank you, sir. Thank you, our President, Dr. Nirmal Surya, sir, for arranging this session.
Thank you. I think we had a very good session, and we covered almost all.
Thank you, Meshram. See you on 11.
Thank you.
Thank you.
Yeah.
Thank you.
Thank you, everyone. Thank you, Dr. Vinay.
Thank you.
Meshram, Dr. Surya. Bye, everybody.
Thank you.
Bye. It was
Thank you.
a wonderful
Thank you.
session. Bye.
Again
Bye.
soon.
Thank you. Thank
Thank
you.
you.
Thank you. Thank you.
Thank you, Mansi.